Good afternoon. The time is now 4 p.m. I call to order the meeting of the Health and Mental Health Committee. A copy of the agenda for this meeting may be found on the county website under the tab for the Legislature. Please silence your phones and electronic devices. And at this time, I ask you that you please rise and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Caroline, can you take a roll call, please?
Absolutely.
Amo, Benelli, President Ellers,
Here.
Feller, Ramos, Sutherland, here, Tui, Stotel,
Here.
by President Green.
Thank you, Lori. Okay, up first, we have Lacey Trimble, Commissioner of Social Services and Mental Health. And first on the agenda is item A, request to accept and appropriate funds from the New York State Office of Mental Health to support school-based mental health services for children, youths. These funds will be allocated to cover startup costs in the Cornwall Middle School, Cornwall High School, and Truman Moon Elementary School. It's $75,000. Legislative request number 311. Can I get a second?
So this request is similar to ones I've come to you before with. The school-based clinics this past year have had the benefit of the state allocating funds for startup. This is new. I hope it continues because it makes it much easier to start up and sustain these programs. For schools, for most schools, it's $25,000 per school. For schools that are deemed high need by OMH, based on Medicaid population, it's a $40,000 startup cost grant that you receive. The allocations are specific to those districts. So it will just help us get started in these new programs as we continue to expand.
Any questions?
On the chart where it has the appropriations, the state aid then has put yours next to it.
Oh, they're each under one of the clinics. So one of the satellites is a satellite of our Port Jervis clinic and the other two are of our child and family clinic.
Thank you. Any other questions? All in favor?
Aye.
Any opposed? Passes. Next, we have request to accept and appropriate state funding from the New York State Office of Mental Health. The funding is for supported housing, stipends, and targeted inflationary increase, TII, in the amount of $142,539. Legislative request number 318. And second.
So these again are state dollars that are awarded to counties through funding letters specific to certain programs. These particular funds for targeted inflationary increases are similar to COLAs that we received in previous years, except because they're under the TII program, they cannot be used for salaries of administrators and executives. They are only for frontline staff. And they have to report on the fact that they're doing these frontline staff raises to help recruit and retain staff for these programs and not spending the money on upper level management staff.
Do you have any questions? All in favor?
Aye.
Any opposed? Next, we have the monthly update.
Most people were in the room when I talked about SNAP. I just have to thank our outpatient clinics. While all of this was going on, SNAP funding was in question. They really made sure that all of the people we serve in our programs were aware of where to get resources, how to get needs met, and connected them to places when those needs needed to be met. Again, same with HEAP, we're making sure that our outpatient clinics are really notifying people of where things currently stand and how to access benefits so that they don't fall through the cracks. So I just wanted to mention that I appreciate them doing that above and beyond what is normally part of their mental health role. We had the Gene Jonas Professional Development Symposium in Masterson Banquet last week. We honored Kristen Fortuna and Doug Sanders, who have both the Distinguished Service Award. This is an award that has been given for the last 52 years for people who have really made a difference in building our system of care for behavioral health in Orange County. It was a nice event, not quite as many people as we normally have, but we're hoping to get back to normal numbers next year. We also have additional suicide prevention trainings listed and DLA 20 youth training. And DLA 20 is the tool that we use system-wide to identify functional needs for the people that we serve, to help them have really concrete goals based on their immediate needs. And it helps everybody across the system speak the same language, so we all can say, okay, they have these domains of need. How do we get them all in the same place, working towards the same goals? We do offer that for free for all of the providers in the system, and the next one is November 19th scheduled. County operated clinics, we did an RFP for peer support services with funding that OMH provided for startup, and Independent Living was awarded those funds. So they will have peers working out of our outpatient clinics. They will be able to bill for those services through our clinics as well, so that we can hopefully sustain this service. And it's really, the focus is on people who are discharged from the hospital and don't show up for that first appointment. These individuals will go out to the home, go in the community, try to locate them, engage them in services. It also is a service where somebody is disengaged from treatment but still really needs the additional support. They can go out in the community and try to re-engage them in supports and hopefully maintain stability for people. Satellites, as you saw with the recent, we had a few additional. We are really working hard to get a few more done. Chester is now in the works. We are still working on our Goshen Mental Health building, but I think we are in the last stages for that one. That really is an opportunity for, especially when schools are closed, to have a site that's central in the county for the satellites to be able to bring kids to. So that will be very helpful for us, and also allowing some additional off-hour times that are not within our traditional program times. And then lastly is just the data. You can see, they're still producing a lot of services in our programs. Our satellites are looking like they will exceed the services that were provided last year, which is really just meaning that we're meeting more kids where they are. Primarily, we've grown in our satellite locations, which I think is great, because that program makes it easy for parents, makes it easy for families, and it's where the kids are comfortable, since they're used to those locations. A lot less scary than walking into a clinic where you have adults. Corporate compliance, we had no self-disclosures in August, and no systematic issues were identified. They meet quarterly, so we will have another update in the next meeting for next month. Not on the agenda, but I just wanted to mention, because it just came yesterday, that Oxford House has opened an additional house, another men's recovery home in Newburgh. This is something we funded through opioid settlement dollars through an RFP. We fund a staff person who helps set up these homes. The individuals who are living in the Oxford houses are all people who are in recovery from substance use, and they work together to pay the rent and all of the bills in the house. They all have different roles. They have chore schedules. It's very independent and peer-led. And it has been very successful. I get a report every month from them, and so far they have been about 93% every month of people who maintain their sobriety in these houses. So I'm really excited that they've opened another one in town.
So does that make 9?
Yes.
9 now?
9.
Would you be able to, if it's okay, next month have a kind of like a report of just how they're all doing, and just something in writing to kind of,
Absolutely. Yes, they are very good about submitting their data.
Something that we were very, very excited about during all of those meetings, making sure that we were able to have something like that. And I'm glad to see that it's so successful.
Yes, us too. It's very exciting, and it's nice that it's nice neighborhoods, it's nice communities, it's really independent and self-sufficient, which is wonderful.
So thank you.
Thank you very much. You have a great day. Happy Thanksgiving.
You too.
Up next, we have Department of Health, Lisa Lee, Deputy Commissioner of Health, and Gretchen Reardon, Deputy Commissioner of for the monthly update.
Good afternoon.
Good afternoon.
So as we sort of previously had hyped, we had our public health summit on October 28th, and it was very well attended by over 140 community based organizations and some school officials who all had a part to play in giving us input and then just, hearing how we can use the data that we collect and develop into our community health assessment to make decisions about what the priorities are, should be, and the status of health of Orange County. There's going to be a little bit more about that in the epidemiology section. As far as positions, we're very pleased to announce that Louisa Sampson has been hired to fill the Director of Health Equity. Yeah. So we're very pleased to have her. She was previously a public health fellow. Before that, she had actually worked as part of the COVID ComCare contact tracing. So she's familiar with the health department, but this will be the first time she's actually working with the health department. So we're very pleased to have her. We're pleased that we have been able to hire the three public health engineers that the plan was approved here at this committee. We have also hired 2 public health technicians, and we're just waiting on hiring a principal clerk. So we're hopefully getting that filled soon. Our new engineers are very young, and will take a little time to learn how we do things here in Orange County, but hopefully will be a great asset to us, especially as, for those of you who know Burgess, he is retiring at the end of the year. And just as far as things that we're sort of doing in the community, on Saturday, November 1st, we have had a men's health screening at the Armory in Newburgh. In addition to the screenings, there were 2 doctors who were present to give health information to the folks who were assembled there. We did 17 blood pressure screenings and 9 prostate PSA exams. We will also we utilize the Medical Reserve Corps, but also Mount Sinai brought their health bus up from the city. They will be coming to the Warwick VFW at the end of March, which will be a very large screening opportunity for folks in that area of the county. Not generally where we are, but they will be able to do that. And we have ended the farmers market program in Newburgh. Lots of folks were able to get fresh fruits and vegetables, but we also had a number of other types of events for families to come to, including nutrition classes and from the regional food bank, and some healthy eating tips from our cooperative, as well as our intervention services, which has a Tuesday program over at the Armory in Newburgh. They also did double duty that day. They were there. It was extremely hot over the summer, and they provided some water play opportunities for the kids who had come to farmers market. And then one update that is not on this sheet, we found out about it after I submitted this. We've talked before about the lead rental registry, which is a law that was passed by the state requiring homeowners who own residential units, 2 or more units where the building was built before 1980, are required to register in the city of Newburgh and the city of Middletown. We have verified that Lead Safe New York, which is the online portal that property owners have to register their property, is live now. And so on the New York State Department of Health website, we'll be updating our website to add those links to that. That's sort of the first step in this program. To be honest, we were sort of told by the state that we would get a pre-populated database to use, but it seems like we're going to have to build it ourselves because they weren't able to do so. So we're verifying properties that were given to us on a list, but I don't believe that the registration has to be completed until the end of March, but we do have it is available if there are people who are concerned about it, registering and getting that done in time. The other thing that I wanted to mention is there is a link on the second page of my update. And it's for an additional survey that we're asking all Orange County residents to complete. We are working with local hospitals to work on our community health assessment, but we have identified the three key areas that from the previous survey, and now we just have one more question. At the top of that page is the community asset survey, which Legislator Tautel asked me to provide some information. There were 5 questions that were asked. Just, do you live in Orange County? What is your zip code? What are the greatest strengths of our community? Where should the community focus its resources and attention to improve the quality of life in our community? And what are the most important health issues that our community should focus on? And the answers are in your update, the top 3 areas identified to improve quality of life: more affordable housing, better jobs and economy, and improving public transportation. The 3 most important health issues identified: mental health, including depression and anxiety, drug use, and aging problems, were what the people who answered the survey identified. So we will be using that information along with other information. Some we gathered at the Public Health Summit, and we'll gather in other ways to formulate what our sort of assessment and then plan of action will be going forward. On page 3, it talks about the engineering plans that have been submitted to the Health Department for review. After the 3rd quarter, we've had 527 plans submitted for review just for the first 3 quarters. Just for context, in 2023, we had 560 plans for the whole year. So we're looking at over 700, estimating about 700 plans that will be submitted to the health department. So Orange County is definitely booming. As far as community health outreach, the Jewel settlement funds have been received. And I believe last time we were here to have them.
We accepted them.
We accepted
need to go back to create a new work, and that request will come next month.
Yes, so you'll be seeing it next month. We have a new breastfeeding support group at the Thrall Library in Middleborough. It will be on the 1st and 3rd Fridays of every month. And as a part of the first screening that I was talking about, we have formed a new men's health committee for Orange County. The purpose of this committee is to create a space for connection and planning events that highlight and champion men's health issues. It's via Zoom. It's sort of like why we have the Sweetheart screening in February, because we all know sometimes men have to get dragged to the doctor. For public health emergency preparedness and response, we do have constantly getting new applications for our medical reserve corps. If anybody has interest, you can sign up online. We're also working on a tabletop exercise to discuss evacuation strategies for nursing homes and assisted living facilities. That it will be held on December 4th and will be part of a larger exercise. There's some ME statistics there. We've had seen 798 cases and 233 autopsies through November 7th, and a total of 309 deceased transported to the EMS office. We had our Board of Health meeting last Monday, and Noah, we need another doctor to serve on this committee. If anyone knows of anybody interested, I know that they need to submit a letter of interest in CV to the legislature. We do have that opening to fill that was left by Dr. Mary Leahy, who's now the.
For sure. And then one of the things I wanted to point out again was the Public Health Summit happened. And in the middle of, about the middle of the second page, there's a link to the presentation that was done there. Very informative, great presentation. We had a small presentation that was given at our Board of Health meeting. So I urge you to look at it, share it if you can. It's also on the Department of Health website.
Yes.
Thank you. Anybody have any? Chairman?
Yeah, I got a call from a funeral director complaining that the morgue at Garnett was not operational and that the bodies were being transported to our facility at our cost. Can you confirm or deny that?
I'm not 100% sure about the hour cost. There were two bodies. Their cooler had broken down, and we agreed to accept those two bodies into our facility. They were with us for a couple of days, and one of them actually was transported to us and then was also transported to the funeral home that does the transports for us.
Right.
And the other one was also picked up within a day or two of coming.
The allegation was that it was a misuse of taxpayer dollars because these were bodies that were never going to come to us and the county was footing the bill. That's why I'm asking the question.
I can find out and get back to you.
Thank you.
On the plan review chart?
Mhm.
Okay, so for the first quarter, it shows 163 plans reviewed, 43 approved. What happened to the other 120? What are they classified as?
Sometimes those plans are not approved the first time that they're submitted. Sometimes the plan as it's submitted needs revisions.
Mhm.
And
Understood.
so those revisions will go back to the engineer who's responsible for the project. So that's why there's the difference of the plans that we got and the plans that were able to be approved.
Gotcha. So where are they now? How do we track the one, because obviously they're not included in the 189.
Correct.
So as legislators and the public, I mean, needing to know the backlog and how they're progressing through, because we hired a bunch of people to try and take care of the backlog. How is that being charted?
So what happens when a project is submitted initially, the engineers review it and submit a comment letter if it can't be approved the first time, and it's sent back to the engineer or the applicant. When it's resubmitted, depending on the number of comments that were made the first time and the amount of review that's necessary, it will be reviewed immediately when it comes back in, and they'll make a decision at that point. Sometimes, honestly, it's like a whole new submission
Oh,
because
yes,
the
understood.
initial one
Absolutely.
was not adequate in the first place. So that some of those that are coming back in for the second time, third time, fourth time, those are fast tracked for review and go back to the engineer who did the original review. A project that essentially is a brand new project on resubmission,
Mhm.
those projects will sort of go back into the regular queue. And at this point, we are around 45 days in between submission and then submitting either an approval or a comment letter.
Okay, so is there any way for your department to make a new column here that quantizes the backlog?
So could you just tell me what you mean by
Like-
the word backlog?
Well, the 120 that didn't get approved,
Mhm.
okay, some projects could get dropped. Some people could submit another thing. So my question then would be, so if someone submits an answer to why they were one of these 120 were rejected,
Mhm.
does that get moved into the 189 for the next quarter, if it's in the next quarter?
If they're resubmitted in the next quarter, yes.
Okay,
But I can, we can look at some information about what what happens with those.
Okay, yeah. Thank you. Thank you, Madam Chair.
You're welcome. Anybody else? Thank you, ladies, and happy Thanksgiving to your families.
Happy Thanksgiving.
Okay, up next we have Lauren Ledoux, Commissioner of Valley Center, and Donna Strucker, Director of Finance, Valley Center.
Good afternoon.
Good afternoon.
I got my regular glasses, so I have to use my sunglasses with readers in it. Present.
Really stylish.
Oh, thank you.
It's really about that. Don't let her fool you.
Little lipstick, some sunglasses, I'm good to go.
Okay, up first, we have requests to declare Orange County Legislature's intent to assume lead agency under the state's Environmental Quality Review Act with respect to the proposed replacement and upgrade of the Valley View wastewater treatment facility and classifying the action as unlisted. Legislative request number 314. Can I get a motion? in a second? Second. Okay.
I really don't have anything else more to add, and this is a necessary step that, we need to take to get moving on this project.
Yeah, just wanted to add one thing. Under the secret regulations, this is classified as an unlisted action. However, you will see within the full environmental assessment form several times and in notices that are being sent out that it's going to be treated as a type 1 action, which is at a higher level. And that's because the funding agencies want to see that it's treated as a type 1 action, even if it's otherwise classified as an unlisted action. So it's very unusual that way. It's only been done a couple of times, usually with very large projects such as this, usually wastewater. I just didn't want anybody to be confused. It actually is an unlisted action, but we're going to be treating it for secret purposes as a type 1 action.
Questions or concerns? All in favor? Aye. Any opposed? Okay. Next up, we have request supplemental appropriation of funds for a proposed 2025 capital expenditure for the improvements for the water plant and wastewater building. These upgrades were recommended in the facility conditions assessment report. This is proposed capital project number 131 in the 2025 capital plan. Upon approval, a new capital project will be created. This is a seeker type 2 action. No further environmental review needed prior to appropriation. The cost is $108,400. Bonding legislative request number 310. Can I get a motion in a second?
Second.
So this is for our water plant. This is not wastewater, water plant, water building. There's some, not quotes, but some prices for the upgrades we're looking to seek for this building. We're looking to get, install a natural gas generator, a chlorine analyzer, monitoring equipment and controls, ATS switch, sync casework, circuit breaker panel, and gas heater. The total cost for that is $49,000, and construction costs with an estimated total cost of $108,400.
Any questions? Hearing none, all in favor? Aye. Any opposed? Next up, we have the monthly financial, can I get a motion and a second, please? Second.
Second.
Thank you.
Thank you. Good afternoon, everyone. The results we're reviewing today are as of October, reconciled to the general ledger as of 11/14/2025. This publication does not have any IGT posting, but we will, in our November financial, you'll see that we are receiving $15,195,836 in
Did
IGT.
you say that again?
15,195,836. And that's for state fiscal year 4/1/2024 to 3/31/2025.
That's a beautiful thing.
Yes, it is.
Thank you. Sorry.
That's okay, no problem. Our revenues are coming in at 27,316,000. Our revenues are trailing over last year around $3 million when I compare year to year. This is a component of being, right now, we had to close another 30-bed rehab unit, so we are at 240 beds. Also, we continue to struggle with hiring the LPN and nursing staff. Lawrence and I are meeting internally with the rest of the staff. We continue to strategize for ways to increase our revenue. Do you have anything to add to that?
No, our staffing has stabilized some, which is good. And we are looking at, a way to, open another rehab unit. Not the full rehab unit, but do it exactly the same way we had last time, where we have 2 units open, a total of, I think it's 36 beds, all private rooms. That's what we had before. We had to close the 1 unit. So, that's what we're looking to do. We're hoping to start that January 1st.
Okay. Thank you. On the personal service side, year to date, we've spent $17,968,000. Equipment, $115,277. On the contractual side, we have $2,995,000 that's earmarked for expenditure. We've actually expensed $9,516,000. Employee benefits are coming in at $13,416,000. Overtime for 2025, the year-to-date results are $1,630,814, down slightly from last year, $1,796,742. And if you turn to the next page, it should be, okay, everybody has it. Yeah, it should be the historical occupancy. Occupancy coming in October at 61.59, slightly up over September's performance. The average for the 10 months of 2025 is 61.68. And if you turn to the last page of the financials, if you go all the way over to the right on the top, it's 2025's performance. You can see that if you go to the year to date, our Medicaid population represents 79.54%. We have a small amount of Medicaid HMO at 2.77 and our Medicare at 12.69. And if you looked at it last year, you see our Medicare was the 13.73. So it's really important that we find a way to increase our Medicare beds so that we can bring up that utilization and generate more revenue for the facility. Thank you.
Next, we have monthly update.
The census the other day when I sent this was 62.77 based on 360 beds and 94.16% based on 240 beds. For October, we had 30 admissions to the nursing home, 15 were new admissions, 15 were readmissions. We had 4 deaths, 5 discharges to the hospital and 15 discharges to home, and 1 discharge to another facility. The CHA census is currently 12. For October, the CHA had 8 new admits, 8 discharges, and conducted 169 therapy and clinical treatment sessions. 80 of those were physical therapy sessions, 79 were occupational therapy sessions, and 11 were nursing. Painting project update, the lobby and the hallways surrounding the lobby were completed, and 1 of the empty units has been completed. We are back in compliance with the New York State Department of Health in regards to our survey results in July. I didn't add this on here, but I'll just mention it too. We did have a support group at Valley View with the Alzheimer's Association last week, and we'll continue to do that monthly. And also, our 5-star rating improved from 1 star to 2 stars after our quality measures reached 5 stars. So right now, our quality measures are 5 stars, our staffing is 4 stars, and our inspection is 1 star. And the total of those gives us a 2-star rating. Unfortunately, the rating system for the 5-star is more heavily weighted on the inspection scores, which we have a 1 star on. But we're proud of the quality measures at 5-star It's the first time I think we've achieved that, and we're really proud of the work that our staff has done to achieve that. So just we wanted to mention that.
You mentioned the one source, so what are we doing as far as trying to increase?
So you can't increase that until you have another survey, So we have to wait.
Okay.
unfortunately. So we're gonna be a one-star for that for a while. So we do audits and we make sure we don't make the same mistakes we did last time. And we do monthly audits on a whole bunch of different things. So our staff has been doing a lot of work on it. All the things that we got cited for, there's plans in place to improve that. So that's what we do.
So it's
Yeah.
an ongoing effort
Correct,
that we hope to see.
correct. We hope it
Positive
improves for the
results.
next time we have survey, yes. That's the idea.
Is that done on a regular basis or just for?
You know, pre-COVID, we were surveyed, we had to be surveyed within every 15 months. And we were always typically on the later end of 15 months. Post-COVID now, we're not getting surveyed until 2 years. The survey years, the survey system is behind. And it's not just Valley View, but it's just the system overall. And, you know, some smaller facilities get inspected within the 12 or 18-month period. For some reason, we've been 2 years on the last two surveys. I don't know why. We don't determine that. It's, you know, random. So I'm hoping we don't have to wait 2 years because obviously we want our score to improve. So, yeah,
Can you request it early to have your ordinance?
it's not up to us. So,
They like to surprise you so that you're not prepared for it.
yeah, yeah. So we'll see. Maybe they'll put us on a shorter cycle. That's hopefully, you know.
Thank you very much.
Thank you.
Happy Thanksgiving.
You too.
Happy
Thank you very much. Thank you. Happy Thanksgiving. You too. Thanks.
We'll take a motion to adjourn. So moved. Thank you.